All right, thanks a lot, Agnes. Well, back pain is something many of us suffer with from time to time, but there is a way to get relief without having to keep that bottle of aspirin or Tylenol handy. Damon Cormier from the Center for Chiropractic and Rehabilitation joins us to talk about treatment options that are available to help get you back into the swing of things. And thanks for coming in, Doc. We appreciate it.
No problem. Glad to be here.
All right, you want to just tell us a little bit about what you can do and who you can treat there at the center?
Well, we treat a wide variety of complaints at the Center for Chiropractic. Your basic headaches, neck pain, mid-back pain, low back pain. We treat a lot of people with shoulder injuries, things like runner's injuries, plantar fasciitis, and shin splints, and things like that. Of course, sports-related injuries, automobile accidents.
Just about everything.
Yeah, just a wide variety of things.
And something we did want to touch on with the automobile accidents, I didn't realize this until recently, that if you get in a car accident, a lot of times your doctor won't see you until you were referred by a lawyer. Is that right? But you can actually go to the Center for Chiropractic and get treated right away.
Yes, people can present in our office and we can treat them immediately following an automobile accident.
And I guess the sooner the better if you're talking about things like whiplash and things like that.
Absolutely, because within about 4 to 6 hours after an injury, your body already starts healing with scar tissue. So the sooner that we can treat those injuries, then the faster and the better recovery you're going to have.
All right, well, let's talk a little bit about what people are doing to themselves in the springtime. It starts to warm up. We think that we're going to come out of hibernation and jump right back in the swing of things. Doesn't always happen that way.
This is our busiest time of the year. You know, everybody's been tied up all winter, kind of in the house, staying warm, and then you get your New Year's resolutions, and so a lot of people are getting out, moving, doing things, and we need to really focus on what we've all been told but don't always do, and that's warming up, stretching, doing little warm-up activities prior to any work or sports-related activities we do.
Okay.
Even before you get out in the yard, if you're mulching or whatever you're doing, use those basic things we've been told about: lifting right, bending right, and again, working, having your work close to you. And I was talking about go out for a 5-minute, 15-minute walk, whatever, prior to even raking your yard or things like that, because if you warm up your body, then you're less likely to injure it.
Okay, that's a great piece of advice, because we think of warming up before we participate in a sports activity, but we don't always think about that before we get out and work in the yard.
Absolutely, and most injuries occur at home. Most injuries occur doing things around your home, inside and out. So just because you're working inside doesn't mean you shouldn't apply those same principles.
And I know I've done it myself. I think a lot of us have. You pick something up and turn a funny way, and all of a sudden you have a pain that lasts for a few weeks. But you can resolve that pain quickly, and it's not like you have to go for 6 months. You can do a couple of visits and take care of a problem for a few weeks. But you can resolve that pain quickly, and it's not like you have to go for 6 months. You can do a couple of visits and take care of a problem.
Absolutely. Every problem is different, but many times in just a few treatments we're able to get somebody back to their normal activities and back to their normal daily routine.
Okay, and we want to touch real quickly on older folks that have arthritis. A lot of people, at least in my mind, I was always thinking if you have arthritis, you don't want anyone really popping and moving things around, but you can actually help people with arthritis pain too.
Absolutely. We have a number of patients, probably the vast majority of our patients have some form of arthritic or degenerative changes, especially in their spine over time. As we age, all those little injuries that we had during the springtime kind of build up, and so we develop certain little arthritis and things, and by working in those areas and keeping those joints flexible and mobile and functional, people feel better, and we're able to get rid of their pain.
There's a lot of great ways to get rid of the pain without hitting the medicine cabinet, and if you'd like to find out more, you can contact Dr. Cormier at the center. They can get you feeling better in no time.
All right.
Thanks for coming in.
You're welcome.
Well, coming up next, updating your wardrobe while hanging on to some of your old favorites. We'll be back after the break to see how the Sewing Company can help.